The death toll from the novel coronavirus in China is up to 563. There are now more than 28,000 confirmed cases in that country where the deadly illness originated. Here at home, another person in Ohio is being monitored tonight for respiratory virus.
Now, this is the third person here in the state. This after the State Department of Health says tests for the first two came back negative. NBC4's Eric Halperin talked with ODH officials tonight who work closely with the CDC as they keep a close eye on these cases. Eric?
Mark, on the CDC's website, you can see just how many of these cases there are around the country, how many have come back positive, how many have come back negative, and how many they are still waiting for results on. And just today now on the ODH's website, you can look at those similar numbers for the state. Since the start of this outbreak, we've heard terms like in isolation or quarantined, and we wanted to know what that really means for those patients and the community.
In the middle of flu season, the novel coronavirus is capturing the attention of the country and the world. Sometimes we hear people have been put under isolation. Other times we hear they're quarantined.
It's very nuanced, the difference between the two, but it is significant. And it's also something that we do all the time.
According to the Center for Disease Control's website, isolation is when someone is infected and are not supposed to be in physical contact with anyone else. The CDC's website says quarantine is when someone is separated from others because they may have been exposed to a disease but are not showing symptoms.
The big difference is isolation is for individuals who are ill, quarantine is for individuals who are well but may experience the disease and be able to spread that to other individuals.
In many ways, Ohio Department of Health Medical Director Dr. Mark Hurst says what people are supposed to do is similar to when they have more common illnesses.
We hear about influenza, which is much more of a threat to Ohio than coronavirus is. And one of the things we advise is that you should stay home. So that's really self-isolation when people who are ill with influenza stay home in order for them to pay attention to their illness and get better and to not spread it to others.
And if it does get to a point where a patient is under investigation,
epidemiologists have a methodical way that they go back and track who has had exposure to them and then determine whether that exposure was significant or not significant.
And oftentimes people check things like their own temperatures and send those back to local health departments. Again, Ohio is at a low risk, and as for the latest case, test results are expected in the coming days. Local for you, I'm Eric Halperin, NBC4.
Thank you.